The lungs are a pair of spongy, air-filled organs located on either side of the thorax. The trachea conducts inhaled air into the lungs through its tubular branches called bronchi. The bronchi then divide into smaller and smaller branches called bronchioles. The bronchioles eventually end in clusters of microscopic air sacs called alveoli. In the alveoli, oxygen from the air is absorbed into the blood. Carbon dioxide, a waste product of metabolism, travels from the blood to the alveoli, where it can be exhaled. Between the alveoli is a thin layer of cells called the interstitium, which contains blood vessels and cells that help support the alveoli. The main function of the lungs is the process of gas exchange called respiration, otherwise known as breathing. In respiration, oxygen from incoming air enters the blood, and carbon dioxide, a waste gas from the metabolism, leaves the blood. A reduced lung function means that the ability of lungs to exchange gases is reduced.
Asthma is the result of restricting of airways and inflammation in the bronchioles. Asthma results in increased mucus production, which causes the difficulty of breathing. Symptoms of asthma include shortness of breath, coughing, and sneezing. Flare-ups can be caused by exercise, allergies, or other situations where the air quality is low. Risk factors of asthma include having a relative, such as a parent or sibling with asthma, having an allergic condition, being overweight, or being a smoker. Asthma is caused by both environmental and genetic aspects. Asthmatic attacks increase as the temperature drops because oxygen cannot diffuse across dry membranes. Cold, dry air causes an increased risk of upper respiratory infections and can trigger asthmatic symptoms more often during the winter. Over 25 million people suffer from asthma in the United States, and each case is specific to the individual. Asthma can range from mild and barely noticeable to extremely severe. There is no cure, however, asthma is a controllable illness. If asthma is diagnosed during childhood and the proper measures are taken, about half the cases result in symptoms decreasing as the child approaches adolescence. Medications and inhalers make asthma manageable, but it affects people in different ways, and even the best treatments available in some patients, asthma is resistant to all current therapies.
One of the main triggers of asthma is smoking, which children can be affected by secondhand smoke in the following ways. Children who breathe secondhand smoke can have more frequent and more severe asthma attacks because secondhand smoke can cause children to develop asthma. Children who breathe secondhand smoke are more likely to get pneumonia, bronchitis, and other breathing problems that can improve because of their poor lung function. Children who breathe secondhand smoke are more likely to have more middle or ear infections, and infants are at a higher risk for sudden infant death syndrome. This syndrome is the main cause of death in babies between 1 month and 1 year of age. Secondhand smoke can also result in infants with low birth weight or be small for gestational age.
Smoking has detrimental effects on the lungs, and it drastically hinders your breathing and your ability to be active. It makes dealing with every sickness harder, whether it's a cough or a cold, or something more serious like pneumonia or lung cancer. Lung cancer is a common result of smoking, as 84% of all lung cancer deaths are caused by smoking. When you smoke, the cells that produce mucus in your lungs and airways grow in size and number, and the amount of mucus increases and thickens. This makes it a lot more difficult for you to breathe. It also decreases the number of air spaces and blood vessels in the lungs, which causes less oxygen to be sent to critical parts of your body. Smoking also reduces the number of cilia in your lungs, which are supposed to decrease the pollutants in your body. The lack of cilia to clean the lungs will make you more prone to sickness and infection. All of these side effects of smoking show just how dangerous and destructive it is for your lungs. A shocking statistic is that one non-smoker dies of secondhand smoke for every 8 smokers. Overall, smoking has no benefits or positive effects on you or those around you. It drastically affects the quality and health of your lungs, but it also severely damages your body as a whole. To keep yourself and others healthy, don't smoke. Non-smokers who are regularly exposed to secondhand smoke at home or work have almost double the risk of heart disease. That translates to about 50,000 fatal heart attacks a year in non-smokers. Smoking is also detrimental for non-smokers. There are many ways secondhand smoke can cause harm. People whose partners smoke are nearly 5 times more likely to develop asthma in adulthood than those who are not exposed to secondhand smoke. But it doesn't just affect your lungs. It also causes deterioration in other parts of your body, like your skin, your teeth, heart, bones, and many other places.
Asthma also has many social effects. The cost to society of asthma in the U.S. is over $50 billion per year in the healthcare expenses, missed school and work days, and early death. Another interesting effect of asthma is that childhood asthma has skyrocketed in inner cities. Asthma disproportionately strikes the poor, who are at least 50% more likely to have the disease than those not living in poverty. While the reasons are not completely clear, research by the Environmental Protection Agency and the Centers for Disease Control and Prevention demonstrate that a combination of poverty-related issues trigger attacks. Because of asthma, children miss approximately 13 million school days per year. Children living in poverty, who are already at a higher risk for failure, are therefore more likely to fall even further behind in their schoolwork. Overall, the lungs are essential for breathing and therefore essential for life. Asthma is a disorder of the lungs that disrupts the process of respiration and can be detrimental to the economy and individuals' abilities to attend school or work. Here are some questions for consideration. 1. Is society responsible for improving air quality? 2. Should we have more laws regulating smoking?